And now to talk more about this, we have Sarah Warren, a registered nurse and mental health advocate. Thank you for joining us.
Thank you so much for having me.
So we just heard a lot of detail about what conditions are like for nurses, but you are a registered nurse. Does that jive with what you are seeing? You know, is your experience the same? And is that why it's come to this?
Yes, I think it's interesting that the hospital statement is a choice in shaming the nurses who are striking. The reality is patients are going to need care forever, right? Patients come in with more complex disease processes. We are going through a continued global pandemic, and patients are going to need care for a very long time, and the need for nurses is going to continue to rise. These decisions are not made lightly. Nurses have been striking for the same issues for decades. These hospital systems and these care settings just have not changed enough in order to meet the demands of patients, as well as the needs for nurses to be able to provide safe, high-quality care for their patients. When a nurse strikes, it is not only for the benefit of themselves, it is also for the benefit of patients, their safety, and maintaining their dignity.
Well, I understand this is the second time, though, that this year that there has been or could be a strike. I guess the date is December 11th, so you could still avoid this. What happened after the first round of striking? Was nothing fixed that you have to do this again?
Yeah, so when it comes to negotiating with hospital systems, at the end of the day, they're going to prioritize their own needs, their ability to maintain profit margins. And sadly, that means not meeting the demands of these nursing staff. And if you don't meet the full demands that these unions present, you're not addressing all of the issues. So it's important for these hospital systems to truly consider what these demands are, why these nurses are striking. And the reality is it is because of their environments, not because they are selfish, not because they are putting anyone else but these patients first. These strikes are designed to protect patients and to change the environments that they're working in that are causing harm not only to patients, but also
you said that, but why strike and then come back and then strike again? Why not stay on strike? Why not continue to negotiate? You know, I don't understand why you're going back to it if it apparently didn't work the first time.
Yes. So there are definitely processes that go into play here. And so you can't do an extended strike because that would mean patients would not be receiving care for an extended period of time. So if demands aren't met in a certain time frame, then they have to strike again. And so there are processes, there are waves of strikes. So that's why they happen quarter to quarter, if that makes sense. But again, they're going to continue to fight for what their patients deserve and what staff deserve, regardless of what these hospital systems think or feel about their actions.
All right, that is Sarah Warren. She's a registered nurse. We're talking about the potential for 15,000 nurses to go on strike as of December 11th. Sarah, thank you for joining us.
Thank you so much.
It is a huge issue. And the fact that nurses have said it's not just because of the pandemic, it's because of working conditions prior that have been exacerbated by the pandemic.
That's right.
We need to pay attention.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.